Hi, everyone. I'm Janice Wood. Welcome to a Senior Citizens Forum and presented by Benefits for You 2 Insurance Services. And at Benefits for You 2 Insurance Services, we specialize in Medicare and health insurance. If you're watching all those commercials, it's asking you if you have all those benefits that you need, or you can get money back on your Part B. Please question what's going on with that. Not everyone getting a lower premium on their Part B Medicare is the right thing for them, because you may be losing some of the benefits that you have because of that premium. So even though it's not open enrollment time at this time, I would be more than happy to review those benefits for you. But just be careful of anybody who is calling you and question to make sure you're not losing benefits when you change to something that may have a lower premium. But today, I don't know if you're all aware, but it's Arthritis Awareness. And I have Dr. Dramber Voitenko back from Voitenko Wellness in Tustin, California. And Dr. Dramber has been on our show in other seasons. This is the first time we've had her back in this season. And I'm excited. And I'm so glad she suggested talking about arthritis. Mm-hmm. Talked about many, many other subjects that I've gotten positive feedbacks on. But you brought it up about arthritis, Amber. Mm-hmm. I just started thinking about those different types of cartoons that are out there that show the old lady, the hag, old lady with the old gnarly fingers and the and the knees all hunched over. Mm-hmm. And people don't look quite that bad, but I know I had a mother-in-law who was absolutely a beautiful woman. She had gorgeous hands, but as she got older, her knuckles were really swollen. Right. And it looked like those gnarly hands that they were talking about.
Right.
Yeah. And I have friends that they can't get the rings on and off.
Right.
Because of that.
Importantly, what about the folks that you probably know that have neck pain, mid-back pain, back pain, shoulder, hip, knee?
Hips, knees. And I look in the mirror and I'm going, I've got those old gnarly knees now.
Mm-hmm. Okay? Yeah, that arthritis. Yep. Yeah. Well, one thing, I mean, obviously being a doctor of chiropractic, I specialize in helping the spine, right? That's our specialty. Right. Of course, we're very, very good at helping to create movement in shoulders, elbows, wrists, hips, knees, ankles, feet. But why I talk about the spine is because, really your spine is protecting and housing your spinal cord and nervous system. So your nervous system controls everything, right? Your muscles, your organs, your glands, your tissues. So the spinal column, it is so important to keep it moving and arthritic free, because you're basically protecting the nervous system. Because the more that you have arthritis and you have problems with the spinal joints themselves, the more problems you have neurologically. Just alone with the stress on the nervous system because of it. So now, good news is with chiropractic treatment, when there's 3 phases of degeneration. And when somebody is in phase 2, which is the start of having bone spurs and lack of movement and disc compression and nerve entrapment, you can stop and slow that with chiropractic care. Because usually what occurs is it's in a segment or 2, so above and below, you can protect that part of the spine. Sometimes when someone's in phase 3, which I'll show you. So this is, see how nice that is?
Right.
Nice movement, good space for the nerves, spinal cord going through.
Right.
Phase 1 is compression of the discs, right? Which
you're starting to feel that in stage 1?
Yeah, you can. Actually, this is the crazy thing about misalignment of the spine and going into the phases, some people have more pain in normal with a disc that slipped or a muscle strain or a nerve entrapment than they do by the time it's here at phase 3 where it's completely fused. And why that is because there becomes a point where neurologically your body has been used to being this way, right? The bummer part is, though there may not be any pain, these nerves go somewhere. And when you're in phase 3, there's disc death and nerve death. So those nerves, wherever they go, let's say it's your low back and they go to your bowel, your bladder, your reproductive organs, something is being affected by the fact that that nerve's not communicating. Even down your legs, like people will get sharp shooting, burning, numbness, tingling because this nerve is not functioning properly, right? So that's the thing with pain. Pain's subjective. That was a very good question because people always think, well, do you feel it in phase 1 at all? Like, wouldn't you feel it more here in phase 3? But really, pain is subjective. So it's really about what's happening with their spine, right? So this is phase 1. I'm going to show you phase 2. This is why they put this in the model. Usually where you get disc bulging or disc herniation is in phase 2. But you see how the bones are starting to form there. This is full phase 2. And then, of course, this is phase 3. So you can see the difference.
Yeah.
But the good news is even here in your spine, whether it's in your neck, mid back, low back, it's not going to be the whole spine most of the time. So therefore, this is osteoarthritis that I'm talking about. Therefore, above and below it, maybe you're in phase, 1. And then you've got your phase 2 happening here, right?
Mm-hmm.
You can protect above and below this segment. And you can stop this from completely fusing with chiropractic care.
So I have a couple of questions for you, okay?
Yeah, perfect.
All right. So my first question is that I know if you have pain, okay?
Right.
Sometimes you don't stand the right way. So you're using a different, which can hurt another part of your body.
Correct, because it starts to compensate. Yes.
Compensation for that pain.
Right.
Right. And I don't think people realize
Right.
just because it hurts here,
right.
It may hurt over here because of that.
Right.
It's not near each other. So
yeah, that's such a good point. That's a great point. So the interesting thing about this type of arthritis, which is exactly the point you're bringing up, osteoarthritis is a mechanical postural problem. It's not genetic in this sense. So when a joint is misaligned, like you're saying, let's say it's somebody's low back and they have a joint that's misaligned and maybe it's more misaligned on the right and it's causing them more pain on the right. So now they're walking funny, they're tense up here. Because it's over time, it's slow going. Like osteoarthritis takes anywhere from 15 years plus or minus 5 years, right? Mm-hmm. So because it's over time and it's a slow progression, people don't realize they wake up one day and they're like this, or they're like this, or they're dragging their foot.
I've watched one lady that I've known for many, many, many years, and I've seen her go from here slowly all the way.
Right.
Not doing it slowly right now to here.
No, right. So, and that's why people don't, because remember, pain's subjective. So maybe at one point she had pain in a certain way, but then her body started to cope with it. It became her normal and she just moved through that progression, right? It's funny because though we're talking about, 65 and older, the thing is, the good news is, and I always say this because I treat Medicare patients, you can stop and slow arthritis, whether it's in your spine, your hip, your knee, with chiropractic care and doing certain stretches and exercises, right? But I really try to educate people, even though you're not in any pain in your 20s, let's say, or whatever, even in your teenage years when you're very athletic, or maybe you're not even athletic, but you're just super active person, you're doing different things in your life and trying different things. Those are the times to make sure that you're aligned so as to not form bone, because this bone forms right here because you're not aligned, whether it's in the spine, your shoulder, your elbow, your hip, your knee, your wrist, whatever. So, educating, like even on this, I'm so thankful that you allow me to come on and talk about these important matters with the body. But for those that are listening, the whole key is you really want to not only help your own self with your spine and posture, but also educate people who are younger than you, like, hey, don't wait till it's too late and now you're getting surgeries or you're just living in pain, right?
One of the things that I thought was really interesting, because I was reading, it said that 58.5 million people in this country have arthritis.
Correct.
And of that, I think there was the percent, I can't remember the percentage, were children.
Right. Well, and so good point. So there's many different arthritic conditions. So, some of the arthritic conditions are autoimmune. So it means that their body's attacking itself. So you have those circumstances. You also have injury, fracture, but even sprain, strain. I've been talking a lot about this lately. When people get hurt, there's minor and then there's death, right? I mean, that's what happens with injury. And when you are injured, when you're younger, you tend to kind of bounce out of it and heal quicker, and then as we get older, it gets harder. So, unfortunately and we've talked many times about this, you and I, about nutrition, our soil being depleted, the foods we eat, and all of that comes into play because there's a lot more, like in regards to arthritis and autoimmune disease, there's a lot more of that now. I've been practicing 22 years. There's much more of that now than there was when I first started to practice. It's interesting, but in regards to arthritis, so those conditions that are autoimmune related, or if someone has scoliosis or postural problems, the sooner you can get to a chiropractor and get, examined, x-rays if needed, the sooner you are to living a more happy, moving, less pain kind of life, right?
As a senior, I know you wake up in the morning, you're going, well, where did this come from today?
Yeah.
It wasn't here before, okay?
Right.
It's just, and then maybe it goes away, but then
Right.
it's back. And we've talked before about how we can tolerate so much pain.
Yeah.
And then all of a sudden you can't tolerate it any longer.
Yeah, your threshold, everybody's threshold's different, right? Some people get a paper cut and they lose their mind, where other people are on horrendous accidents, you know what I mean? And in 2 months they're at it, so right.
Yeah, absolutely. So, we've talked before in the past. So if anybody wants to look up myself or Dr. Amber, she has her own shows that she posts, and she has a lot of good information there in regards to a lot of what we're reviewing again today.
Yeah.
But exercise, I always find I feel better once I get out there and I exercise.
Right. And the reason for that is joints, like the spine, your hips, knees, everything likes to move. That's actually how your joints get the nutrition, is through movement. So a lot of times, and you're so right about the pain scale, Janice, because somebody who can tolerate the discomfort and get themselves moving will actually feel better. Because many times I hear like, oh, I can't do that. That's going to hurt. I already hurt. That's going to hurt more. Where actually, once you start moving at a gradient and you build that strength and endurance, you feel better. So you're right. Once you get moving, and I'll tell you, that's a telltale sign for this osteoarthritis that I'm talking about. When someone wakes up, they have discomfort, they feel stiff and tight, that typically is a morning situation from after waking up that goes away throughout the day. If it's not going away, it means that there's definitely a neurological component to it. It's not just muscular and joint related. But if you could create an environment where you're not always waking up stiff, tight, and in pain, that's ways off of that stress of pain on one's body, right? Even neurologically, because pain is stressful. It affects you neurologically. So
Well, yeah, but because pain, I also find if you have any pain, and if we're a senior, we know that's going to push up your high blood pressure.
That's right. Your whole systems react to that. So anything you can do to minimize the stress and pain on your body, physically, chemically, and emotionally, you're doing yourself a favor. You're putting years, seconds to days to months to years on your life. You really are. It's worth self-care. Self-care is super important. And you're right. Some people don't think about that. You know what I mean? That's not their mindset. I know we're changing. That's really changed. Even in my profession in the last 20 years, people's outlook of, where they should be when they get older even, right? I mean, like you, Janice, with all that you've done with your, nutrition and diet, and you get your chiropractic and you get your alternative medicine, like it's a thing that helps your body to live itself out in a very better quality of life. If I could spit that out right. It's just better lifestyle,
Yeah, I know, I completely agree with what you're saying. But for those that are not used to exercising, or they're willing to change their diet, okay? Right. Exercise, that walking is so important. Yes, your muscles may hurt for a day or two afterwards, but it's still, I'll wake up in the morning and my elbows, as you were saying earlier, it's like, oh my God, they're stiff. But as the day moves on and I work them out, it feels better.
It does. And people can start with baby steps. I really want to empower everyone who's listening to this. Look, maybe going to the end of your driveway is where you're starting. And then by the next week, after doing that every day, you're, walking 3 houses down and back. And then maybe you're going around the block by a month's time. And then maybe you're out walking an hour and a half by the time 3 months hits. It's baby steps. It's the same concept of anything in your life that you've ever done. You start out slowly and then it gains momentum, and it gains the ability to be able to do that. So
one of the things people can also use, and I just thought of this as we're talking. So many of the smartphones have exercise programs in them.
You betcha. And it's a great way to basically give yourself goals and targets and record. It's kind of silly, but years ago, I actually learned from, it's called The Artist Way. It's a great book. If none of you have ever read it before, pick it up. I know you can get them used on Amazon, but it's called The Artist Way. And it sounds interesting because it's about bringing out the artist within you. But she was really big on journaling. And it's amazing. Her concept of journaling is just, getting it out, all those things in your head, when you wake up in the morning or before you go to bed, whenever you find the time to journal daily. But the point of me telling you this is when you journal and you're, writing down what you're eating, drinking, the exercises, the stretches you're doing, almost like a self-care battle plan of what you've done. It's really cool to go back and go, oh my gosh, this is where I started and this is where I am now. It's like your record of your self-care. And it's a journey, health and wellness is a journey. So I like to encourage everybody to, it's not too late to start. That's for sure.
Yeah, that's a great idea. And it's so funny because Amber and I attended a meeting earlier this morning, and somebody in the breakout room that we were in talked about journaling.
Yeah.
Big time journaling.
Yeah, journaling is a big thing for many people. And I find, and it's a habit, it's a habit you have to form. And many times in my life, I've gone in and out of that. I did that Artist Way course, like, I think I was like 34 years old. And over the years, I've gone in and out. But to bring it back to your point too, with the phone, that's a way to journal. If you're looking at, if you bring your phone with you when you walk, literally there's a health app in the iPhone itself that's already there for you. And it will tell you what your activity's been.
Right. No, it will even tell you how far you walked.
Yes.
How many stairs, but it's not completely accurate because I can walk with somebody and we've gone a different distance.
Right. So I know, but again, it's such a good way, to really motivate you
trying to find that app right now.
Yeah, that app is so cool. And then, these days you can get Fitbits for nothing too, which is, those little bands that you wear. And
well, they also have, if they have iWatches or the Fitbit, a lot of seniors, some of the plans offer Fitbits.
Oh, yeah. And that's great because your Fitbit or Apple Watch will tell you it's time to get up and move.
Yeah.
Yeah.
So if anybody can see here, the little white icon there with the heart in it.
Yep.
That's where you go right there. And that's one of the things I haven't talked about in a long time, but that's a real important app to have. And
and you can put your medical information in there too, which is so important. Any information that someone might need to know about your health and your health conditions.
Right. And if something happens to you, let's say you have to have an ambulance, and everybody has their phones on them.
Right.
Paramedics can push on that app without going into the rest of your app. Because I'm someone that doesn't want anybody to see what else is in my app, because
it's privacy
information, which I have to stay with, just like Amber does within the HIPAA laws. But they can just go in and say, okay, you kept this. I know I'm someone that's allergic to aspirin, so I have that in there.
Yeah.
If they can kill me with the aspirin.
Sure. And it's important. I mean, even things like I have a pacemaker, I've had low back surgery, I have a plate in my ankle, like, that's all very important.
So it's all extremely important. But now I'm going to take us back to arthritis. Okay. So one of the things that I was reading, and it's one of the things that I'm seeing on a lot of different issues that I have, they keep telling you, drink more water.
Right. Yep.
Because that helps with that stiffness.
Yeah. Well, your body is made up of, most of your body is made up of water. So that's how you lubricate your joints and your systems. And also that's how you detoxify. And that's super key because people know about, I need to hydrate, that's what I'm hydrating, but the question becomes, well, why are you hydrating? And it's because your systems and even at a cellular level, your body needs that water to survive for energy, but also one of the big components is detoxification. And I bring that up because 82,000 toxins we're exposed to. And with our bodies breaking down everything into sugar, you need to have enough water to help to have less joint pain. People, when they come in and I've been treating them, let's say for months, and they've gotten better, but then they come in over a weekend and they say, oh, Dr. Amber, I had a terrible weekend with my back pain and my hip pain. And then I say, well, what were you doing this weekend? Oh, well, I had a dinner out on Friday, and then I had a birthday party on Saturday. And then yesterday, I took my grandson to the movies and I, ate popcorn and Raisinets, whatever they had done. And really what it comes down to is they had very little water. They potentially had cake, some kind of sugary type celebration food or dessert, or they had alcohol, caffeine, they ate rich foods. I mean, you name it. And then you have to bring it to their attention. That's not going to benefit them with the arthritis. And the reason for that is because osteoarthritis is an inflammatory response, and inflammation causes pain. So if you're not drinking enough water and you're having a good old time every day with a high sugar diet, high glycemic way of eating, you're eating a lot of bad foods, maybe you're drinking 3 cups of coffee a day or more and you're completely dehydrated, your arthritis is going to cause you more pain.
Absolutely.
Right. So water's key. That's one of the ways to really get your body lubricated, detoxify your body, and give your body at a cellular level what it needs to survive.
And it helps those other organs.
Absolutely.
Process what they need to process.
Right.
Because as we
can't otherwise.
Yeah. We get older, those organs aren't working right. So all those chemicals and the calcium and whatever,
Yeah. All your vitamins and minerals have to be utilized and absorbed at a cellular level, no matter what organ or gland or tissue we're talking about. It's the water thing is huge. I I have you know how I have red light therapy at my office, and part of red light therapy is drinking water. You will not believe how many people come in, and I mean, I believe it because it's a thing. They'll say, well, I drink iced tea. Well, that's not water. What? Well, my coffee has water in it. And the thing is that we have to realize is there's a substance in that. Yes, you're using water to make that drink, but those substances in those drinks are not pure water. So it's real easy. You take your weight, you half your weight, and that's how many ounces of water you should drink in a day. You could take that, your half of your weight and divide it by 8 so that you know how many 8-ounce glasses. But the point is, I mean, if you start with this first thing in the morning, right? And you continue on for your break, your lunch, maybe even right before you eat dinner, you will get that water in. It doesn't have to be, you just can't wait till you go to bed is all, because people panic about it,
I've been finding for me, if I go to the restroom, to the bathroom,
yes,
that I'm getting rid of those toxins in my body.
Right.
So that's when right afterwards, I go and I drink
more water. So good. Yeah, that's a great routine. So there's all these different routines, that's the bottom line. And once you've done something for about 2 to 3 weeks, you'll get used to it. One of the things that we did here, which my office manager thought of, which was brilliant, she would put a timer on her, cell phone. And every time the timer went off, we'd all drink water. And we had a very small office at the time when we started this. So we would yell out water, even when patients were there. So patients would get involved. Like, what do you mean water? It's time to drink water. So the patients who had their water bottles, we'd all be drinking water. It was brilliant. It really helped us.
They can now start doing that with their iPhone, their iWatches.
Yeah.
Their Fitbits or whatever type of exercise thing.
Those really, that is a really good thing. The Fitbits, the iWatches, and the phones, that'll help with water for sure. And again, the whole topic that we're talking about, why is water important? Because the more water you drink, the less inflammation you'll have, which means less pain, especially if you have arthritis. Remember, itis, anything that ends in itis is inflammation. So arthritis means joint inflammation, and inflammation causes pain.
Right. Now, I'm going to ask, my son has been pushing me, I don't know for how long, to drink ginger tea.
Okay.
Where he takes and he grinds up ginger and he puts in water and to drink ginger tea. And he goes, it's going to help get rid of the inflammation.
Right.
So it finally broke down a couple weeks ago. And I said, well, what is it going to hurt? Okay.
Right.
If it works, it works. If it doesn't work, I don't have to continue it. I don't love the taste of ginger.
Okay. Yeah. So I know some people, it's really hard for them.
Yeah. So I've tried it and now I'm adding it to my food.
Oh,
and
perfect.
I have some inflammation that's gone away.
Yeah.
So is ginger really one of those natural type things that work?
It is. And like turmeric, there's so many. I mean, antioxidants, that really helps with inflammation and pain, which is arthritis. Taking omegas. Some of the omegas that I love, I bring this up. This is an important one because a lot of people go, well, I'm taking krill, I take krill. And that's fine, but most of us really need a lot of essential fatty acids. We need those omegas. So, don't be like, even if you're like, oh, but I have high cholesterol, because that's big, as we get older, omegas are good for you. So taking 2 tablespoons of flax oil or, taking enough borage capsules or even flax oil capsules. I'm really big on that. Cooking obviously with olive oil is a helpful thing too, but we need a lot of essential fatty acids. So that's also super helpful. So, and antioxidants, that's your fruits and vegetables. Now, some of us, here, studies, right? What is it like? It's 22 peaches to actually get the vitamins and minerals that a woman could get from 1 or 2 peaches I think it was in the 50s. So our soil's definitely depleted. So one of the things I always suggest is juicing, for vegetable juice. And then you could add in like a half an apple or maybe a half an orange. But, that's a way to get antioxidants, which also will help with pain and inflammation. Herbally, though, a lot of people use the turmeric, they use the ginger. They'll also do, which I think is very important, which is more protein based, is the collagen. People get really, really good results when they do collagen daily, which, just like Janice is talking about, you can start adding it to your foods. Collagen doesn't necessarily have a taste, some that you can purchase. You can put it into a, like protein shake in the morning. I know there's even companies that are strictly collagen protein shakes. So anyway, those are some other, suggestions as far as joint health.
Yeah. And arthritis is something you can't avoid.
Yeah. Well, no, so let me correct you on that.
Okay, great.
Yeah. Osteoarthritis actually is mechanical. True that you can't avoid it if you've done repetitive trauma and never gotten chiropractic care or never strengthened your body, right? Then yes, you're in trouble. You've fractured something, they have to go in and fix that. You're probably going to have arthritis in that joint. Doesn't mean you have to, though. That's what's cool about understanding the importance of chiropractic, physical therapy, and exercise. And all three of those are separate from themselves. It's not like, oh, I went to physical therapy all my life, I won't have arthritis. That's not really how that works. Or I was in the gym, for 30 years. Believe it or not, being in the gym for 30 years, if you're not aligned, you're just strengthening joints that are misaligned, which is going to cause arthritis. So it's a combination of making sure that, if you've had an injury, the physical therapist gives you the strengthening exercises, as well as keeping your body fit, as well as getting chiropractic care, because they're not one or the other. Unfortunately, I'll tell you, these bodies, Janice, you got to brush the teeth, you got to feed them, you got to exercise, you got to get chiropractic, you got to get dental work,
But like with all of those things, and I'm going to have someone on to talk about exercise.
Yeah.
Okay. But if you don't exercise correctly, you can also
injure yourself. Yeah.
And then I'm a shrugger, and as Amber knows, I exercise all the time. All right. So, but because I shrug, it affects
your neck.
My neck.
Back. Yes. Totally.
And so when you're exercising, I just want to bring this out real quickly. You got to make sure you're exercising correctly, especially if you're using weights and you're using the machines.
Yeah.
Stuff. You could hurt yourself with it. But if you're just starting out by walking a few steps down your driveway,
right?
Okay, that's a difference. But if you go to exercise, make sure you're working out correctly.
Right.
I'm going to have a trainer on.
Oh, that'll be so good. Yeah.
And we'll continue with this.
Yeah. It's so great, because it's true. Like for me, many times I am referring my patients out. A lot of my patients who seek out chiropractic care are actually huge advocates of exercise anyway.
Right.
But there still are some of my patients that maybe haven't been exercising in a while. And so getting them back onto that is so important. So there's many times where I refer out for exercise. Also, I refer out for massage. I refer out for physical therapy. All those things are super key. So
massages are wonderful. So if anybody hasn't tried it.
And it's therapeutic. People think, oh, that's an extra. Well, it is and it isn't. I mean, when you get massage, you are actually helping your body physically, chemically, and emotionally. It's a whole, it's the three stressors. We have to have that body care for sure. Yeah. Agreed.
You just gave me an idea in talking about massage. Okay.
Oh, yes.
Because Amber and I have a friend that's a massage therapist.
Yes.
I should have him on the show.
Yes.
Yeah, definitely. So, Amber, this has been a great subject for the day.
Yeah.
And I hope everybody is aware of their arthritis.
Yes. And what they can do to help themselves.
Even though the show is geared towards seniors, but as I said a little bit ago, children can get arthritis.
Right.
And I don't know if you treated any children. But
Oh, yeah. I've treated children from everything from sprained strains to scoliosis to autoimmune diseases. So, Yeah, the sooner that you can get onto a treatment plan and regimen, both chiropractically, nutritionally, along with stretching and exercises, it just helps to prevent them from living a life of, pain and discomfort, which, isn't the way to live, really.
Right. And I'm going to have Amber's information posted here.
Mm-hmm.
And please be a contactor. Please contact me if you have any questions. I'm sitting out in my backyard and I see my dog is 18 and a half years old and she's full of arthritis.
Oh, I know, the puppers. Yeah.
I mean, so your furry babies even get
yes.
arthritis.
Yes. Your puppers needs like collagen, omegas.
Right.
Salmon oil. They have those salmon oil pumps, actually.
Oh, they do. Okay.
Yeah, it helps them.
So everybody does. And it's just, as much as we want to avoid it, there's no way of, have to use our arms, our hands, our feet, right, our back muscles, and it's all connected. And
right.
Before I talk to Amber or other people in the medical industry, I know that what's going on here can affect my toe down below.
Right.
You don't think that could happen, but it does.
Right.
It absolutely does. So
it does.
Amber, thank you so very much for attending today.
Yeah, thank you for having me.
I hope to see you soon again. I know I will. Okay.
Yes.
So, thank you for participating in the show.
Yes, no problem. You're welcome. Thanks for having me, Jan.
Hi, I'm John Thomas. I want to share with you a professional products and services directory we call Going Solo Directory. And you need to check this out. If you want exposure to your business or are seeking professional product or services, this directory has it all. And that membership, for the many special features, you get the benefit of a worldwide exposure with a 40-minute video interview on an international business show showcase. All this for just one low annual fee. For more information, contact GoingSoloDirectory.com.